In observance of Breast Cancer Awareness Month, Trust Bank organized a breast cancer awareness campaign at its Bruceby branch on Tuesday. The event featured a surgeon specialist, Dr. Babakar A.S. Sow, from Edward Francis Small Teaching Hospital, who educated attendees on the signs and symptoms of breast cancer, preventive measures, how to conduct a self-exam, the importance of regular screening, and the value of mammograms. Breast Cancer Awareness Month has significantly expanded in its efforts to raise awareness and funds for research. Over the past few decades, more organizations have launched their own initiatives to highlight the fight against breast cancer each October, increasing public understanding of the disease. Breast cancer occurs when abnormal breast cells grow uncontrollably, forming tumors. If left untreated, these tumors can spread to other parts of the body, potentially becoming life-threatening. Breast cancer typically originates in the milk ducts or loopholes of the breast. During his presentation at the Trust Bank Awareness Program, Dr. Babakar A.S. Sow discussed the risk factors associated with breast cancer, emphasizing that while the exact cause is unknown, certain factors increase the likelihood of developing the disease.
Among the recognized risk factors for cancer of the breast include one, overweight. Right. Overweight is one of the risk factors of breast cancer. The other risk factor is people who start seeing their menses very early, less than 12 or before 12 years, right? And their menses stop coming very late. So they have a long period of exposure to estrogen, to hormones. That also increases the risk of breast cancer. Lack of breastfeeding or the breastfeeding is protective. So it's also more recognized among women who have not had breastfeeding or have not had, who have not been breastfeeding, right? So breastfeeding is kind of protective to cancer. Also, family history. People who have family history of breast cancer have been observed to have higher incidence of breast cancer. However, that does not mean that if one does not have breast cancer in his family, the person would not have breast cancer. No. In fact, more than 50% of people who had breast cancer did not have any family history.
Adesi Sinjai, a two-time cancer survivor, says her journey of living with and overcoming cancer.
It was a stage 2. And then by the time I actually started treatment, it had grown to a stage 3. So I did the BRCA test, same thing as he mentioned, and found out that it was probably in my genes, but they weren't sure because I didn't know about it. But when they did I had to, because it had grown from a 2 to a 3, we had to do not the conventional method of having surgery and then chemotherapy. I had to start the chemotherapy for almost 9 months and then do the surgery. So chemotherapy was rough because chemotherapy is poison. It was rough. I lost my hair. I looked like a completely different human being. Survived that part, which I believe is the hardest part. Like he said, cancer itself is not painless. The lump didn't hurt. It really didn't. I just happened to notice it there and told a friend who is what they call a physician's assistant. And she was like, well, it doesn't feel fluidy, so let's go get it checked out. So, but after chemotherapy, I decided I was given the choice to do either a double mastectomy or just a lumpectomy. Once I did the BRCA test and it came back that it was probably in my family, I said, you know what? And doing research and reading, which I do a lot, I found out that chances I will come back on the other breast 60%. So I said, you know what? I'm just going to have both of them removed. I had reconstructive surgery. If there weren't guys here, I'll show you ladies just so you know that you can still have your breast and have reconstructive surgery.
Trust Bank's Managing Director, Njilan Sangor, announced the bank's commitment to providing opportunities for staff members to get their mammograms done as part of their ongoing support for early detection and prevention.
In Pink October month, there are many free mammograms on offer. But even without that, you have your medical insurance cards. I don't know what the hospital does mammograms, but I know Bafro does because I had one done at Bafro. So The choice is in your hands, really. You need to take care of yourself for the sake of your families and your children.
According to research, breast cancer is the most common cancer worldwide, with approximately 2.3 million new cases diagnosed annually. It accounts for 1 in 8 cancer cases across both genders and represents a quarter of all cancers in women. Tragically, 70% of breast cancer-related deaths occur in resource-limited settings. In these regions, low levels of awareness, limited access to early detection services, and health system barriers contribute to late diagnosis and poor outcomes. Furthermore, in resource-constrained settings, breast cancer often affects younger women, leading to their high rates of premature mortality and maternal orphans. Reporting for Kirfatu, I am Fatu Silla.